Hi, I'm Eliza Cabana, editor for Aesthetic Authority, and I'm joined today by Dr. Randolph Waldman, a facial plastic surgeon practicing in Lexington, Kentucky, and also medical advisor for Aesthetic Authority. Dr. Waldman, thanks for joining me today.
Thank you, Eliza.
Um,
Happy to join.
so at the advent of the corona crisis, Dr. Waldman, you had a pretty smart idea to create an online group of physicians like you who are in private practice within the aesthetic specialty. Today, we've got nearly 100 members, all chiming in daily as issues arise that affect the multi-specialty aesthetic practice. How important do you feel this group has been to both sharing and learning from each other during this time?
Well, I think it sort of acts as a combination of an informative experience, but it's also a little bit about support. And it's nice to have colleagues that you can ask questions to and lean on. And all of us have perhaps some different expertise in the area of the practice, business model, or understanding government regulation, or dealing with patients, or dealing with family. And it's really been a very informative interaction that we've had with our colleagues. And I'm really happy that we started it.
So of everything that's been discussed there, and I know it ranges from business concerns to personal concerns, taking this now into your own surgical centers once things reopen, what have you found to be the most important?
I think just in terms of financial survival of different practices, and different practices in different parts of the country certainly have different experiences, but I think we have a collective experience that most of our practices, which feature elective surgery, have pretty much been either really slowed down or in most cases stopped. And so now we have to figure out, how do we support staffs that range from 5 people to 60 or 70 people? How do we support them? We're all small businesses. And so we've all been watching what the government does, both in terms of restriction and also in terms of trying to make certain that businesses stay viable financially. I think we've also been worried about our own health. A lot of our discussion has evolved around, when is it safe to go back, and how will we run our practices when we get back, and are there certain procedures that are riskier to do than other procedures? Is there testing that'll be available? Lots of questions like that. So I think both a business and a functional point of view to our practice, or a clinical point of view, I should say, to our practice, has been extremely important in these discussions.
And what would you say the biggest outstanding questions are right now? What are we still wondering about?
I think we're still talking about the SBA loan. We're talking about whether we should allow our employees to go on furlough or whether we shouldn't. There's pluses and minuses to that. We're discussing getting back into practice and what that's going to look like. Will our practices be identical to what they were prior to March 15th, or will there be changes? Will we be testing people? How will the financial landscape be at that point in time? Are we going to experience some of the symptoms that discretionary practices like plastic surgery practices experience in recessions, or will it be business as usual? I think we're all trying to figure that out, and we're trying to figure out when we can get open back up. What we tell our employees who are looking to us for leadership and for answers. And the world has changed. There's no question about that. The country's changed, and it's changed forever, I think. We're going to be doing things differently in our practices. The new term, social distancing. Will we have 10, 15 people in our reception area at the same time? Will our doors be open to our exam rooms? Will our staff, when we're doing small procedures like injections that can spray, will we be wearing masks like dentists have been doing and hygienists have been doing for a long period of time? I think a lot of things we're going to have to look at. And collectively, I think we can gain a lot of knowledge and as I use that word, support from our colleagues around the country, particularly those that are in private practice.
A lot of questions that still need to be answered.
A
And
lot.
that's really one of the great things about this private group that you've got going on right now. You really find out everything as it's happening.
Yeah, when we talked about it, it was like, well, should we do this? And then within what, a day or two, there were 75 people jumping in, and everybody was looking for answers, and everybody was contacting each other individually. When this in this way, we could have really discussion groups and roundtables or virtual roundtables, and I think we can, as you and I have talked about, we can perhaps extend that to truly virtual roundtable discussions where we can have discussions, a couple of 2 or 3 times a week because things are moving so fast, Eliza, that it's hard to keep up with them unless you're interacting frequently, and that's what these discussion forums allow us to do.
Yeah, we're certainly going to take a look at doing the live roundtable. So things are they still relatively quiet in Lexington?
Yeah, we really haven't. I mean, listen, this is a horrible disease. It's a national crisis. I've got a daughter on the front lines in New York City and another on the front lines in Madison, Wisconsin. It's a real war. This is a really devious and aggressive, yet unknown disease. And so all of us have a lot of respect for it. Having said that, in Kentucky, we're very fortunate. I think my the hospital that she works out of has almost as many cases inside that one hospital as we do in the state of Kentucky right now. I think the people in government in Kentucky saw the experience in New York, and they jumped on a preventative bandwagon very early. A lot of people complained about that. Businesses were shut down very early. All sporting events were shut down. The state tournament in Lexington and basketball was shut down, and people were really upset. But I think they're beginning to see that it did have a positive effect on keeping Kentucky from becoming, chaotic like we've seen at so many of the large cities around the country.
Right. Well, we'll look forward to continuing this discussion in the very near future and delving a little bit into more detail with some of these issues. So I want to thank you, Dr. Waldman, for joining me tonight to talk about some of these things, and we'll catch up again real soon.
Thanks, Eliza. And by the way, I talked to my assistant from Crossville, and they even have some cases in Crossville right now, unfortunately. So it's actually the coronavirus has no preference for large cities or small cities. It's finding its way into some pretty unusual locations where you think maybe it could have been avoided, but
Yeah.
somehow it's finding its way into small city USA. And it's a terrible problem. And I hope, you hope for medication that will, and we've seen a few that look somewhat promising, but ultimately the problem will exist until there are mass vaccinations. That's
Yeah.
how we got rid of smallpox. That's how we got rid of polio. Um, that's how we got rid of some of the worst diseases history's known. And this one's certainly right in there with the top illnesses. And we're living in a period of time that perhaps none of you that are younger could have even imagined that would affect the country in this way. The last one was 100 years ago that was of this magnitude. My mother's 102, and I kid her on the phone saying, "How come you don't remember the last one 100 years ago?" And but it's true. There aren't many people alive that have experienced both. But we're hoping for better days ahead, and we have great medical scientists and people working on our behalf, and probably 24/7 now. I think we have great leadership in our country, and I think we'll overcome this, and our practices will hopefully mirror that resolve, and we'll all return to normal sometime in May or June, I hope.
That's all we can do is hope at this point. Trust the scientists and the medical doctors. Yeah.
Yeah, and I think, like I said, I think this is like searching for no pun intended, the Holy Grail, but everybody's looking for the fountain of youth. Well, in this case, everybody's just looking for a cure for coronavirus, or at least a vaccine to keep us from getting it. And it's a race, and there are many, many pharmaceutical companies and very bright people in research labs, and have all the respect in the world. But I think that the other thing that we're finding, and I'll leave the discussion at this because I think it's a really important thing. I think for, and maybe some of you that aren't physicians, but you're certainly in the healthcare field, but I think because of a lot of reasons, there was a general decline for respect for people to go through 4 years of medical school and 4 to 8 years of residency training. And I think that there was just a trend that doctors were not nearly as well respected in today's world as maybe when I first started practice many years ago. I don't know why that's happened, but I think I saw a gradual erosion. And now I think that people are saying, we can have all the lawyers and we can have all this and all that, but without doctors and nurses, we're nothing. And we've almost been brought to our knees, and it's a war. And the people on the front lines are the doctors and nurses, because when they walk into a room, they could be somebody that gets an infection from that person. I know of a 26-year-old resident in my daughter's hospital that passed away 3 days ago. And it breaks your heart for some parent. But all those young people and the doctors that are on the front lines of this battle, they're all risking their lives. And it's said many times, I think there's a new respect for doctors, and for these young doctors particularly, who are risking their lives to save the people that have gotten sick. And many of them will get sick. And so it's something that I think it's going to reframe, if you will, the image and the role of medical professionals, doctors, nurses, PAs, nurse practitioners, respiratory technicians, really the whole group of people that work in a hospital. I think it's reframing the discussion, and perhaps that's the very, very, very small silver lining that's going to come out of this for the medical profession.
Yeah.
But the other thing is, when we think about war, Eliza, think about PTSD, and I think you and I discussed this before. I don't know what the trauma is going to be to these young people who have witnessed so much death and dying among young, viable people, and trying to reason it. And people that go off to war, at least in recent wars, but to some degree, this is a war just like any war with lots of casualties, and it has an effect on people, and that's another thing, another bridge that we're going to have to cross.
Yeah, good point. All right, Dr. Waldman. Well, thank you once again for taking the time to talk with me tonight.
Always good to see you, Eliza.
And we'll set something up and continue the discussion very soon.